Assalamualaikum and a very good morning to our madam. My name is Julia MAISARAH binti Jalil and my matrix number is 2025184059 together with my partner.
My name is AALIYAH Izzati binti MOHMAD NAZIR and my student ID is 2025150687.
We will be presenting on the serious public health issues that affect millions of people. Imagine seeing that nearly 1 in 2 men on the street of Malaysia smoke. This striking reality shows how smoking impacts health, society, and the economy. So today, we will explore this issue together through our topic, which is societal cost and gender profile of smoking between Malaysia and the US. Next. So tobacco use is a major global health issue responsible for serious disease and millions of deaths every year. Beyond individual health, it is also creates significant and social economic burdens affecting family, communities, and also healthcare system. Each year, tobacco is responsible for over 7 million deaths worldwide, including many among non-smokers exposed to second-hand smoke. This causes diseases like cancer, heart disease, with placing a very heavy burden on the healthcare system. Reducing tobacco use is crucial to improving global health and also saving life. By understanding the impact of tobacco, we can develop effective policy and prevention strategies to reduce its harmful effect and protect our health, our public health. So based on our topic, the purpose is number one, to compare smoking prevalence between men and women in Malaysia, and number two is to illustrate the broader health and economic impact of tobacco use. Next.
Next, I will explain about background of the topic. First, Malaysia still has a very high smoking rates and the progress to reduce it is still very slow. According to the National Survey in 2019, more than 40% of Malaysian men are smokers, while only around 1% of women smoke. This shows a big difference between men and women. Even though many campaigns, warning, and programs have been done for many years, the smoking rate only dropped a little from 43% in 2011 to 40% in 2019. This small change show that smoking is still a common habit in our society and stronger action are needed to reduce it. Second, smoking give a big and serious impact on health. Smoking is known to cause dangerous disease such as lung cancer, heart disease, stroke, and long-term breathing problem. These illness not only affect the smokers but also their families and people around them. Because more people are getting sick from smoking related disease, hospital and clinic need to spend more money and resource to treat them. This create a heavy burden on Malaysia healthcare system. That is why the government start to make strict rules such as banning smoking in restaurant and discussing generational tobacco law to protect the public and reduce further health problem. Next. Next is central idea. The central idea of our presentation is that smoking is still a serious health issue in Malaysia, especially among men. This high smoking rate and slow progress in reducing it continue to create health and economic problem for the country. Because of this, stronger prevention effort and better education are needed to help reduce smoking and improve the nation overall health. Next. This is the pie chart. This pie chart shows the overall health and economic impact of smoking in the United States, and we use it as the comparison to understand what might happen in Malaysia if smoking continues to increase. From the chart, the biggest portion is premature deaths caused by direct smoking, which take up about 60%. This means most of the impact came from people dying earlier due to smoking-related disease. Next, around 8% come from second-hand smokes, where non-smokers are affected even though they do not smoke themselves. About 20% of the pie chart represent healthcare costs. These include hospital treatment, medication, and long-term care for smoking-related illness. The last 12% show lost productivity, which happen when people cannot work or have lower work performance because of smoking and its health effect. Overall, this chart shows how big the burden of smoking can be, and it warned the Malaysia could face similar problem if we do not improve our tobacco control policies. Next.
Thank you, Alia. So I will be presenting a bar chart about smoking rate by gender in Malaysia for 2019. So this bar chart displays the prevalence of current smokers by gender in 2019, adopted from the code blue. So in this chart, you can see two bars. So number one is for males and second one is for females. The percentage for males shows that 41% of men are current smokers, while only 1% of women smoke. So this means out of 4.9 million adult smokers in Malaysia, almost 4.7 million are men and just 135,000 are women. The chart also shows that 59% of men and 99% of women are not current smokers. So smoking is overwhelmingly a male behavior in Malaysia, with about 34 male smokers for every one female smokers. Smoking in Malaysia mostly affects men, with far more men smoking than the women. This large difference between the gender is very obvious when we look at the national data. Next. So, in the conclusion is Malaysia is heading towards a serious but preventable health crisis. Smoking rates, especially among men, remain very high, leading to growing health problems and rising economic costs. So, stronger and more effective policy and prevention efforts are urgently needed to lower smoking rates, support communities at risk, and build a healthier future for the country. That's all from us. Thank you.
Thank you.